Over 20 years ago, some researchers found that Ritalin use was associated with a great increase in lymphoma. And anything that boosts your adrenaline system creates stress and harms the whole body. And you can't think of these things as simple brain active drugs because they affect your whole physiology.
Ritalin is slightly less addictive than methamphetamine because of its longer half-life. The other reason it's less addictive in the children is because it is taken orally, and so the person doesn't get that intense rush. Now, the children have figured this out, and the way around it is they crush the pills up and they snort them. And in fact, in Sweden, they outlawed Ritalin to be given to children because there was so much abuse of it.
But what we know is actually far beyond that, and that is you are at risk for developing psychological, emotional problems, sometimes the very kind of problem you were trying to treat to begin with, for 6 months to 2 years after you stop the medication. And it's interesting, there seems to be a common pattern. It's true of neuroleptics, antidepressants, mood stabilizers, that the increased risk is about tenfold within the first 6 month time. So for example, with antidepressant medicines, you're about 10 times more likely to become depressed within the first 6 months of stopping an antidepressant than you would be if you never took the drug to begin with. The same is true of psychosis. If you take an antipsychotic drug, it may suppress the symptoms for a while, you may cruise along fine, you may be in full remission for years. When you stop the medication, especially if you stop it abruptly, you're at about 10 times the risk of becoming psychotic than a schizophrenic person who never took the drug would be in the same period of time. People need to know that. That's part of informed consent, and it's something that they're not being told, and it's being downplayed in the psychiatric literature. What psychiatrists would prefer to believe is that the underlying illness is reemerging. You stop your drug, you become depressed again, that proves you needed the drug. So the solution is to go back on the drug. They don't think that maybe it was the drug withdrawal that caused the problem. And the worst thing you could do would be to go back on the drug, other than maybe in a small dose for a brief time to make the withdrawal more easy. But it does not mean that the person is doomed to lifetime medication, which is what they're being told. That's what patients are being told nowadays.
Since the brain is an interlocking system, it's designed so that any disruption causes a global readjustment. And when you push one function, the whole brain is put under stress to adjust itself. And so you mess up everything. And the chronic amphetamine addicts end up with terrible brain damage and just probably brain shrinkage.